Visual acuity after retinal gene therapy for choroideremia. Definition: choroideremia is an incurable genetic disease of causes blindness in men and affects approximately 1 in 50,000 people. This disease is caused by defects in the CHM gene, which is located on the X chromosome, and this is why the disease affects men and women differently. Women have two X chromosomes, and so a normal CHM gene on one X chromosome can compensate for the defective CHM gene of the other X chromosome to some extent. Men, however, only have one X chromosome. There are currently no effective treatments available for choroideremia, but it have developed a new technique of gene therapy, which believed may help to slow or even stop the degeneration. It involved putting normal copies of the affected gene back into the cells of the retina to help them to function normally.
Form of blindness that some call especially cruel. People with choroideremia are born with perfect vision. Researchers in the U.S. are building on a clinical trial overseas. They're about to test a therapy designed to stop the disease and make it reverse. In bright daylight, Tyler walked about with no trouble seeing his friends. But inside, where he would say, those eyes sometimes don't work. Or I have trouble thinking. Trolls, like a drone. At age 6, Mark's doctors diagnosed him with a genetic condition, choroideremia, which caused people to progressively lose vision, which Susan was a very wealthy blindness team. Mark's grandfather used the condition
Pros and cons. The researchers report of the patient status 3.5 years after treatment. Patient 1 and 4 had advanced disease at baseline with a studied eye survival line below normal on the early treatment of diabetic retinopathy study. Charged by 3.5 years, visual acuity in the treated eye of the patient 1 had increased by 21 letters, more than 4 lines, from baseline. In patient 2, it decreased 18 letters, more than 3 lines. Meanwhile, vision in this patient untreated eye continued to decline. The other 4 patients had good visual acuity at baseline and therefore less room for improvement. Patient 3 started with a visual acuity of 18 ETDRS letters and was able to return to that level after cataract surgery. Improvement in the treated eye showed up an electrophysically study. Because choroideremia progresses slowly, the effects the treatment may take years become fully clear, the researchers notes.
if you're suffering from an incurable disease, to be told that there's nothing that can be done and no one is doing any research into it is one of the worst things that we can possibly say. At least if I can say to people, there isn't yet a cure, but we're working on developing a cure through this clinical trial, it just changes their whole concept. It gives them hope. Choroideremia is prevalent in about 1 in 50,000 people all around the world, as far as we know. And these people go blind. It affects men, and the reason they lose their sight is because they're missing a vitally important gene, which is at the back of the eye, and it's important for keeping the eye healthy. So what we're doing with our gene therapy research is that we're actually using a virus, a tiny viral particle, to deliver the correct gene back into the cells at the back of the eyes in these patients. The eye is a fantastic target organ for gene therapy because the genes that cause retinal degeneration are well documented. There are plenty of them, and we can know exactly what single gene to put back. The other thing is that we have a control eye, so we can look at the degeneration in one eye and see how it changes compared to the other. And although it's a little bit early to talk about the results that we've seen so far in terms of visual improvement have been very, very encouraging. The disease itself is relatively rare, but the concept of what we're doing, the technology, everything we're doing in this trial will be relevant to other causes of blindness, and we can think of retinitis pigmentosa, which is a disease that causes blindness in about 1 in 4,000 people in the UK through similar genetic mechanisms. And also potentially age-related macular degeneration, which has similarities to choroideremia in many ways, and it's a disease that causes blindness in 300,000 people in the UK, and is increasing each year with the increase in the elderly population. One of the benefits of being in an academic research rather than a sort of a pharmacological company or something like that is that we can be open and collaborative with our work. There is no financial incentive for us in what we're doing. We're all working together for the same goal, and I think that makes a very, very good working environment. It's fantastic to see the realization of what I've been working on for many, many years, but we're not just talking about technology. I mean, I have patients in my clinic who've got choroideremia. They come in, they've been visiting me for 3-4 years. To see the expression on their face when they know that we're developing this clinical trial is something that I will not forget. Mothers with affected sons, people of working age, people of our age who are in the process of losing the very last remnants of sight, to suddenly know that there is potentially something out there. I mean, as a clinician, to be able to help people, particularly when it's something that has been up until this time been incurable, that's something that I find very rewarding and very satisfying.
Issue applying Ecuador. The gene therapy for choroideremia is still in study and has not been tested yet this treatment in Ecuador.
We have, in the laboratory here, developed a new treatment involving gene therapy, which is a new technology being developed in medicine. We are treating a disease which is called choroideremia, and this disease affects young men. It presents in childhood, and it causes progressive loss of sight and eventual blindness by the time the patients are in their 40s. So the disease was first described over 100 years ago in 1872, and there are lots of patients affected by it worldwide. The disease is caused by a missing gene. A gene is a part of the DNA, which is the code that we have in our bodies to make cells work correctly. The DNA is missing a certain gene known as REP1, and that gene is on the X chromosome, which is one of the parts of the DNA in all cells in the body. Because it's on the X chromosome, the disease affects primarily men. It causes sight loss in men and presents in childhood. So gene therapy is a technique we use where we artificially make the missing gene, and we use a virus to put it back into the cells that need the gene in order to survive. In the case of the retina, which is the lining of the back of the eye, these patients are going blind because the cells are degenerating. So what we plan to do, and what we are doing in this clinical trial, is we are injecting the gene back into the cells, and we're using the virus to carry the gene to infect the gene into the cells, and then hopefully preserve vision in these patients who've got this terrible disease. Choroideremia affects about 1 in 50,000 people. So that is a fairly rare disease, but it's prevalent worldwide. So in the UK, there may be 1,000 people affected. Worldwide, there may be 100,000, possibly more, because in many countries the disease is underreported. What's unique about it is that it's instantly recognizable to most eye specialists. So if we can look into the back of the eye and we can see a disease where we know the genetic cause by its appearance, it's much easier to develop a gene therapy treatment because, of course, we can instantly collect a load of patients without needing to do complicated genetic testing because we can sort of see what the disease is at the very beginning. So far, we have injected 6 patients, treated 6 patients, but we have approval to treat a further 6, which we'll be doing later this year. The preliminary results of the study are very promising, but any primary study on something new like this is designed around safety, first of all, and once we're happy that the treatment is safe, we can then expand the trial to include more people and, of course, look at more complicated outcomes of their vision. It's altogether 1 year, a period of when we're actually treating the patients, and then we follow them up for 2 years. Because the degeneration is quite slow, so we won't know necessarily instantly if it's worked. We need to wait a couple of years where we can compare the rate of degeneration in the treated eye to the degeneration in the untreated eye, like a control. And we estimate by looking at the data on the rate of degeneration that we'll know within 2 years if we've been successful in stopping it. Well, we engineered a viral vector which we designed in our laboratories and tested in the University of Oxford. And the vector which we designed has to be made in a certain way to enable it to be injected into patients. Obviously, you can't just inject viruses into patients because there could be some toxic effects. We're very fortunate here in Oxford in that we have a clinical biomanufacturing facility which is approved by the Medicines and Health Products Regulatory Authority, the MHRA in the UK, which allows us to bring in, store and develop these very complicated gene therapy products in a way that wouldn't be available in many other academic centres in the UK.
Application in medicine. In order to administer the gene therapy vector known as AAV2-Rev1, the eye clear internal jelly must first be removed by a type of keyhole surgery known as vitrectomy. This procedure is quite safe, and eye's clear internal jelly is gradually restored by the body in the weeks following with surgery. After the vitrectomy, the small volume of fluid contains the AAV2-Rev1 vector is injected a small volume of underneath the retina through a very fine needle that is narrower than a human hair, creating a small fluid-filled blister or bled under the retina. This small area of retinal detachment is temporary and disappears over about 24 hours. The fluid is slowly absorbed by the retina. This type of surgery normally lasts about an hour, and the operation itself, without the gene therapy, is a routine procedure of patients with conditions such as retinal detachment.
A novel gene therapy developed by Oxford researchers may restore vision to patients with a previously incurable form of blindness. Choroideremia is a rare genetic disease in which photoreceptors in the retina and underlying vascular layer, known as a choroid, degenerate. Degeneration of the retina and choroid begins during childhood and develops into blindness in old age. Choroideremia is caused by a defective CHM gene. In the gene therapy, a functional copy of the gene is inserted into a virus vector. The vector is then used to deliver the gene to the degenerating photoreceptors in the retina. 6 of the 9 patients enrolled in the therapy trial have reported improved vision 6 months following treatment. While this technique cannot regenerate cells that have already been destroyed, it can restore normal functioning to defective cells.
Conclusion. Best corrected visual acuity is a reliable marker of visual function. It contrasts to Leber congenital amaurosis, in which visual acuity is generally profoundly affected early in life. Choroideremia and most types of retinitis pigmentosa are characterized by progressive loss of the visual field, with visual acuity remaining close to normal levels until the very late stage of disease. Therefore, in some patients, the effects of preserving visual acuity with the use of retinal gene therapy may take several years to become apparent.
Choroideremia is a rare genetic disease in which photoreceptors in the retina and underlying vascular layer, known as the choroid, degenerate. Degeneration of the retina and choroid begins during childhood and develops into blindness in old age. Choroideremia is caused by a defective CHM gene. In the gene therapy, a functional copy of the gene is inserted into a virus vector. The vector is then used to deliver the gene to the degenerating photoreceptors in the retina. Six of the 9 patients enrolled in the therapy trial have reported improved vision 6 months following treatment.